I would say that ACLs are usually the minority of injuries, thank goodness. The majority of injuries we see are about the kneecap and the tendons which attach to the kneecap. And I'll refer to a model here to help show you. So the ACL is a very, very devastating injury to patients, but fortunately it is not a common one compared to other knee problems. If you look at soccer players in general, of all the reported injuries in terms of collegiate soccer players from Division I through Division III, over a 15-year period, 70% were in the lower extremities. And not all of those, fortunately, require surgery. So if this is a model of a right knee, you can see that there's a white structure in the front of the knee. Well, if we look at it from the side, this basically is the attachment around the kneecap, or what we call the patella. So the tendon which attaches the kneecap to the shin bone is called the patella tendon, and the tendon which attaches the powerful muscle in the front of the thigh, called the quadriceps, to the kneecap is called the quadriceps tendon. So typically we will see areas of tendonitis where the quadriceps attaches to the patella. We have patella tendonitis either at the attachment to the kneecap on the lower end or to the attachment to the shin bone. So common pain that we see is pain around the front of the knee at these particular spots, and also sometimes pain as the kneecap glides back and forth towards the end of the femur, and we call that a patellofemoral syndrome. So those are the common things we see about the knee. Other joints we see ankle sprains, by far and away more common injury in soccer players, and as you yourself can attest, hip strains or hip flexor strains are also pretty common. But interestingly enough, we see kids who change sports, going from outdoors to indoors or indoors to outdoors, commonly will have these disorders or tendon issues as they transition into that sport.